I'm David Hanauer, and I'm the creator of EMERSE, and I'm here today to tell you a little bit about the system and how it's being used. So the first question is, what is EMERSE? EMERSE is a search engine for the electronic health record. In this case, it searches both CareWeb and MyChart documents. It actually also searches radiology reports, pathology reports, and other kinds of reports. The key is that EMERSE searches the free text documents, that is, the documents that are without any kind of structure. So these are the things that you might type or dictate that end up in the record that you then have a hard time looking through without a search engine to help you find it. We've really optimized the system to work well with medical documents so that it's not just a standard search engine, but it works very well with medical information. We've worked very hard to make it user-friendly, and we've added a lot of things that should be helpful. For example, we have a lot of synonyms that are in the system. So if you search for hearing loss, for example, it will also help you search for terms like hearing deficit, impaired hearing, hard of hearing, deafness, etc. So I think those kind of things really help users find the things they're looking for, even if they don't always know what it is they need to find. So you may be asking, why do we even need a system like this? Well, the answer is partly because we have so many documents now. We have probably over 60 million documents in our medical record system at this point, and we're adding about 27,000 new documents every single day. So because we have so many new documents being added, it's really important to have a way to search through these to find the important information you need. You may also ask, well, what's it used for? And this is one of the key things. Knowing what it's used for may help you decide if it's useful for you as well. So I think it's really used for three different major categories. The first one is research. So for research, it's being used for things like eligibility determination. This means that you may have certain characteristics in a patient set that you need to look through to determine if that patient is actually eligible for your study or not. And these are things that may not be easily available through other means. So it may not be available through the coded information. So you might be looking through information that's locked in the free text. Smoking information, for example, or other detailed information about the patient that may not be easily available elsewhere. It's also used for cohort identification in the first place, which is related to eligibility determination. And also, in large part, for data abstraction. So this is where somebody has to look through the notes to pull data out to enter into some other database for research. So it's used heavily for data abstraction by many different groups. It's also used in the clinical setting. So how is it used in the clinical setting? Well, I actually use it in my own clinic sometimes when I have patients who come in and I need to answer a question about what happened to them in the past. So somebody might come in and they might say that they had a terrible headache 5 years ago and they had some special medication that worked really well for them. And without knowing what that medication was, we can search for terms such as headache or migraine, find where that note is mentioned from several years ago, and then we can go in and see the medication that we had prescribed to know that that might be the one that worked well for them. And we use it for a lot of other reasons that are similar to that. If we hear a murmur in somebody and we want to know when that murmur first appeared, we can search for terms like that as well. It's also used in the clinic for prior authorizations. So this is where you might prescribe a medicine and the insurance company denies it. And the only way to get that medicine for the patient is if you can prove with some documentation that you have tried other less expensive alternatives and they haven't worked. So using the EMERSE system, you can search for those episodes or mentions of those other drugs, find out where it's discussed, and provide that as documentation to the insurance companies to provide the support so you can get those authorizations and get the medications that the patient needs in a timely manner. It's also used for various operational reasons. So there's different groups around the health system that are using EMERSE for their daily work. One of those is infection control. Infection control uses the system to basically look for different kinds of infections that might not be present anywhere else except in the clinical notes. It's being used by risk management. It's being used by the PACE and QMP groups. And it's also being used by your billing and coding groups for the inpatient coding aspects of the hospital. The best way to understand how EMERSE is used, though, is to actually look at our online demonstrations that we have provided for you in this tutorial.